I'm Rebecca Gordon.
I'm Sylvia Gordon.
And today we're going to talk about what is the Medicare Prescription Payment Plan that's supposed to go into effect in 2025.
The MPPP is part of the Inflation Reduction Act. And you'll be dealing with this AEP. So if you identify a client that has expensive drugs, you want to tell them to enroll in the MPPP during AEP so that the pharmacy will already show it on their records.
So this is a program for super expensive drugs, right? And instead of a consumer having to pay, and when we say expensive, it's drugs over $600.
Right. So your cost share at the pharmacy for this drug would be $600 or more.
And so this program is an attempt to try to level out those payments, right?
Right.
So instead of one huge one, they want to break it up into 12ths. So you're just paying a 12th each month. But when you go buy the drug, do you have to pay anything right then and there?
Zero. So if I have a copay of a drug let's say Remlivid, it's like thousands of dollars for this cancer drug. So I need this pill, it's over $200 a pill, and I need it, and the pharmacist is required to notify me if I'm not enrolled in the plan that I might want to enroll. So let's say I've already enrolled because my agent's super on the ball. I go to the pharmacy, I want to get this $600 prescription. They go, okay, zero, you owe zero. The insurance company will then send you the printout with the projection of how this will look with your 1/12 payments each month. It will tell you their guidance if you're late. There's a grace period if you're late, what the rules are to be terminated and reinstated and appealed. So the insurance company is going to send you all that paperwork.
As well as bill you.
And then bill you monthly. Or however we don't know how ideally they're going to set it up through bank draft so that they can cut down on the administrative costs because they're going to hate this.
I don't know. This sounds like a cluster.
But it's going to be great for the member.
It'd be great for the member.
It's going to be a pain for the insurance company. How about the agent?
It's not going to impact the agent.
All we need to do is explain it and the upside of it, right? It's going to help you.
Yeah. And
it's not going to save you money. It'll just allow you to budget better.
But we really got to make sure that people aren't terminated for late payment.
Right.
Because they didn't get the bill.
Right.
And then they go to the pharmacy for their.
Right.
I mean,
I don't envy the insurance companies trying to administer this.
This looks like a hornet's nest. And what if somebody goes, they get their free drug, and then they switch plans?
Right. How is the insurance company going to get the money back? How about if I take an infusion that's only once a year and it's $13,000 and I didn't pay anything the first month and I got my infusion and then I don't pay? And they're coming after me, get blood out of a turnip, the money and legal fees to try to get that money. It's going to be a burden, put that nicely, for the insurance companies. And they've had a couple years to get ready for it. It goes into effect January 1st of 2025. So during AEP, when you have clients that are freaking out because of the cost of their drugs, there's going to be a lot of freak out this AEP.
So this is great content for those of you who are sending out newsletters, you're sending out blasts or whatever, however you're staying in touch with your clients. This is great for them to know. This kind of gives me a little bit of PTSD from when the ACA said that they were going to fine people if they didn't enroll. And that was just a huge blow up. I mean, people were buying policies. They never paid. They were never fined. They were over-fined. They were fined the following year because it was just all...
The administration lag.
It was horrible. So
This looks like it's not going to be pretty, especially since the companies have so many other things on their plate right now.
God, yeah, a lot of other things.
So it's called the Medicare Prescription Payment Plan, MPPP. It is something you need to explain to your clients during AEP. It'll be a benefit, a positive for your clients that do take those expensive drugs.
Okay.
Stay tuned. Learn more next week. There's a lot to talk about that's changing this year.
See you, folks. So I want you guys to watch this next video. It's from one of our top partners that has a fantastic Medicare lead program. So if you're currently writing Medicare and you really want to go to that next level, their system has worked for hundreds of agents across the country, and we're bringing it to you. Watch it. Let us know your questions, and this might be your next big thing.
As an insurance advisor, you face many challenges getting access to the resources you need to be successful, especially if you're an independent advisor. Most advisors' needs will change as their business grows, and eventually, marketing will become your biggest hurdle to a six-figure practice. Gordon marketing agents have access to a turnkey, proven marketing system that targets prospects approaching their initial Medicare enrollment. You can expect to be introduced to 20 to 30 new Medicare prospects a month with our program. All marketing and materials are done for you. All you need to do is show up and present to a room full of prospects. Our team creates each agent a company-branded presentation deck, marketing pieces, and a landing page that will reflect your company and branding. Each agent also gets a client-facing monthly newsletter to help support and grow their book of business. Lastly, and one of the best aspects of the program is the ongoing coaching and mentoring sessions with successful agents in the program. If you think you're ready to start marketing for Medicare, but you don't know where to start, let us save you time and money with our proven marketing program.